What is provocative therapy? Provocative therapy is the use of clinical reverse psychology and humour in brief psychotherapy. By brief, I mean 5, 6, 7 or 8 sessions of therapy, not necessarily more than that. What is the use of reverse psychology though? Well, works like this. Sometimes we can see or we know what we're doing wrong, but we continue to do it. And when a therapist or a doctor or anyone else tells us to do the opposite, we feel that we are being patronized and we take this advice as being condescending and then we ignore it. But what happens if someone with affection in the heart and a twinkle in the eye encourages us and advises us to continue our self-defeating behavior? We tend to move in the opposite direction. This is the phenomenon that happens in provocative therapy. It's done in a warm-hearted way. The golden rule of provocative therapy is you mustn't do it unless you feel affection in your heart and a twinkle in the eye. So the patient feels, the client feels, and you will feel in provocative therapy, that the therapist is on your side. He or she is smiling and warm-hearted and kind, and yet the words come out are absurd. You could be encouraged to continue doing your self-defeating behavior, to drink more, to take more heroin, to eat more, to exercise less, to screw up your relationships in the way you always have. And you will feel yourself wanting to do the opposite. You will feel yourself wanting to prove the therapist wrong. The therapist might tell you there is no solution to your problem, you'll never meet the right guy. So I'll show him, I'll meet the right guy. That is the reflex, even though you know he's doing it. Now it's very important that no patients or clients are ambushed by this process. It's very important that they not come in to a therapy session expecting normal or orthodox therapy. They need to give permission for the therapist to work in this provocative approach. The way I do it is I say to people, would you like to join me in a sort of bubble of a different type of conversation altogether? And for us to do this, I need your permission to say things to you that are provocative, absurd, ridiculous, cheeky, sexist, inane, rude, vulgar, and highly politically incorrect. I can't be shackled by the handcuffs of political correctness. I need to say whatever I want. Is that okay? And people love it. They volunteer. Of course, say whatever you want. Then we start the provocative process, and it often ends in the person locating the solution to their problems, articulating and asserting that solution to their problems, owning the solution to their problems, and finally enacting the solution to their problems in real life. This is the process of provocative therapy.